This is coming from the U.S. Preventive Services Task Force. Now, it made two changes. It lowered the earliest age for screening from 55 down to 50, and that now applies to people who have smoked about a pack a day for 20 years, which is down from 30.
Really, the expansion of the eligibility criteria for screening reflects that there are certain populations where we are appreciating more and more that the risk can develop at a younger age and with less smoking. African Americans definitely in that category, and probably also women.
Dr. Lynn Tenoe from Yale Cancer Center said about 16 to 18 million Americans will now fall under these new guidelines. And she said one estimate is that expanded screening could ultimately cut lung cancer mortality by 20%, a huge number, considering lung cancer is the leading cause of cancer death in the U.S.
Lung cancer really should be preventable. 120 years ago, it was really rare.
These new recommendations are for yearly screening done by low-dose CT scans. As for cost, Dr. Tenoe said the recommendations help to decide what does and does not get covered by insurance.
When USPSTF makes a recommendation for screening, it should be accessible to everybody. And so that CMS, which is Medicare and Medicaid, should be covering that. And commercial insurers should also be covering that.
I'd like to go over the recommendations one more time because we've only talked about the changes so far, but here they are in full. You're now recommended for lung cancer screening if you're between the ages of 50 and 80 and you've averaged smoking a pack a day for at least 20 years and you're either still smoking or have quit within the last 15 years. If this all applies to you, please go talk to your doctor. I'm Tim Lammers, Fox 61 News.